My name is Jeremy Kaplan. I'm a gastroenterologist here at KRMC. Colon cancer is cancer involving the very bottom part of the digestive tract, which is the colon and the rectum. We actually know a lot about colon cancer, and one of the things that we know is that colon cancer in the general population develops from what's called a polyp. A polyp is a precancerous lesion that's found in the colon, and it's known that for a typical polyp, it takes about 10 years for that polyp to turn into a cancer. For that reason, we perform colonoscopy to remove polyps to prevent the development of cancer. It's also for that reason that when people have no polyps, we say we can wait 10 years with the idea that nothing should develop into a cancer in that 10-year period with all that we know about the way polyps progress. So unfortunately, anybody is able to get colon cancer. About 1 in 20 people in their lifetime will be diagnosed with colon cancer. We do know that the risk of colon cancer gets higher as you get older, and therefore we see more colon cancer in older adults. However, it's unfortunately becoming more common to see colon cancer in an even younger population. Colon cancer is the second leading cause of cancer death in the United States. The symptoms of colorectal cancer include bleeding, changes in bowel habits, changes in stool consistency. In more advanced stages, people can develop weight loss, fatigue, yellowing of the skin, liver problems. Yes, unfortunately, in the very early stages, especially when the colon cancer has not yet spread, people can be living without any symptoms at all. Unlike a lot of other cancers that affect Americans and people throughout the world, colon cancer is actually a cancer we're able to prevent with early detection. Screening tests that are currently available for colon cancer include checking the stool simply for blood. There are other markers in the stool that tests use to risk stratify people for colon cancer. It's possible also to do what's called a flexible sigmoidoscopy. That's a procedure in which we use a camera to look up into the rectum and the sigmoid colon, which is the very bottom part, as that's the most common area to be affected by colon cancer. And then to extend that further, one of the more common things that is done is a colonoscopy, and that's a procedure in which we insert a flexible scope into the rectum and look throughout the colon to find precancerous lesions, and of course to also look for cancer. So there's been a little bit of debate regarding when colon cancer screening should take place or should begin to take place. As of right now, we're recommending that in somebody who is at a regular risk for colon cancer, and what that means is they do not have a parent, sibling, or child with colon cancer, they don't have inflammatory bowel disease, they don't have other cancers. They start doing colon cancer screening at the age of 50. For all populations except for African Americans. For African Americans, we recommend starting screening at age 45. In people who have a family history of colon cancer, we recommend starting screening 10 years before that relative developed cancer, or age 40. I think it's important to recognize that if somebody has no symptoms or no signs of colon cancer, that any of these screening tests are far better than not having any test. But some tests work a bit better than others, are better at detecting colon cancer. And I think it's also very important to note that what colonoscopy allows us to do is to remove polyps before they turn into cancer. So unlike other tests that look for early cancers, we're actually able to remove the lesions that turn into cancer.